Hi there.
Hi, how are you?
Good, how are you?
Good. What seems to be the problem today?
Well, I've been suffering from some fatigue, pressure on my chest, and heart flutters for the past few weeks. And my coworker actually told me that heart flutters aren't symptomatic of a heart attack, so I didn't think it was that important to come in.
Okay, sounds like we need to do some further testing. Let's go get an EKG.
All right.
The first EKG is of a patient with a normal heart rhythm. This patient has distinct PNT waves between the QRS complexes. A patient with an EKG that shows afibrillation does not have any distinct PRT waves. Instead, spasms are present throughout the wave. This represents the chaotic firing and receiving of electrical signals in the heart experiencing afibrillation.
After reviewing the results of your EKG and ultrasound, I have determined that you have atrial fibrillation, or AFib as you may have heard it before. Because you've been experiencing these symptoms for more than a week, you have what we called persistent AFib.
Whoa. So what does that mean?
In a normal heart, the electrical impulses are fired in an organized fashion from the SA node and cause the atrium to contract. The AV node then sends a signal to the ventricles to contract and pump blood out of the heart. In a normal heart, the contractions happen in an organized succession. In a heart experiencing afibrillation, the electrical signals fire in a chaotic manner. This causes the heart to quiver and subsequently the blood is not pumped out in a fluid manner. The highest risk factors for atrial fibrillation include a patient's age, whether or not they have previous heart disease, if they have high blood pressure, the amount of alcohol they consume, whether or not they have sleep apnea, a family history, if they are obese, and if they have any other chronic conditions such as diabetes or lung disease.
What does this mean? What are the treatment options?
Patients with AFib can live normal lives. We will work together to find a balance of what will reduce your episodes of fibrillation. Managing this is the most important next step. We have a lot of treatment options available for you.
Okay.
Most medications prescribed for patients with AFib are blood thinners. This helps to prevent strokes. Some patients can be prescribed electrical cardioversion. This shock treatment that tries to reset the heart. For patients with more severe and unmanageable cases, a pacemaker may be surgically inserted. This will act as a mechanical SA node. AFib can lead to many health complications, but most common issues are stroke and heart attack. Strokes are a result of the blood pooling in the ventricles after it is not pumped out sufficiently. Here it will begin to clot and can then lead to the blockage of oxygen delivery to the brain. Heart attacks are a result of the heart tiring and overworking from continued quivering of the muscles.
We can discuss your best treatment planning moving forward.
All right, thank you.
Have a good day.
Thank you, you too.